Thank you for visiting the Rosenberg Integrative Cancer Treatment and Research Institute, also known as RICTRI. Since you're visiting this website, most likely you or a loved one has recently been diagnosed with cancer. I'm Dr. Mark Rosenberg, and I'm an internist and cancer scientist. My keen interest in researching cancer was prompted by my mother's unsuccessful battle with metastatic lung cancer. I watched her quickly succumb to cancer, realizing that modern medicine had nothing to offer other than palliative chemotherapy. So after her passing, I poured through the world's literature, trying to understand the mechanisms through which cancer grows and trying to come up with a better way to improve cancer treatment. I learned a lot over these past several years, and I'll share some of that with you now, some of which is disappointing, but some which is enlightening. A large study was published in December 2004 that looked at all solid tumors between 1990 and 2004 in the United States and looked at the effect that chemotherapy had on survival. And it was disappointing to realize that chemotherapy extended survival by 2.1%. The median survival in lung cancer was extended by only 2 months in the past 20 years. Similar data was found for breast cancer, colorectal cancer, and head and neck squamous cell cancer. After years of research, it became clear to me that cancer is a very complex disease. And each cancer is genetically unique and is dynamic, meaning it's constantly changing. So with such a complex disease that grows through many mechanisms, it was clear that throwing 2, 3, or even 4 chemotherapy drugs at the cancer was not enough. So I began looking into what I call integrative cancer therapy. And that involves using many different drugs, many of them off-label, many different supplements, and many different modalities to treat cancer, with the idea being to convert an acutely progressive terminal disease into a chronic disease. And I'm happy to say that we have been successful in many cases doing just that. As you explore this website, view the videos and explore the text, and learn as much as you can about integrative cancer therapy. And please visit our donation section. Monies obtained from donation will be used not only to further the research, but also to help families and patients who cannot financially afford integrative cancer therapy. Once again, thank you for visiting the Rosenberg Integrative Cancer Treatment and Research Institute website. Be aware that just because you have a diagnosis of advanced stage or stage 4 cancer, it does not automatically mean imminent death. With your help, we can expand our efforts not only in research, but in educating others, including patients and physicians, that there are other ways to treat cancer, specifically through integrative cancer therapy. Thank you.